Okay, I think I'm live now, and the problem is that I'm in my hospital parking lot and there is really crappy reception here. So let me pull over so I can actually finish this talk about mental health, and hopefully it won't disconnect me before I'm able to finish. So let's talk about, so we talked about therapy and why it's important to go to a professional, because a professional is trained. They're not going to judge you. They're not going to sit here and feel the weight of it. And sometimes we kind of really just honestly burn our family members out. We burn our friends out. It really is helpful. And again, you can do traditional talk therapy, but I also believe in alternative therapy. I think a lot of our issues come from childhood trauma. It might be limiting beliefs. It might be stuff that exists in your subconscious mind. And there's yes, talk therapy is very effective to a degree, but if you've got behavioral stuff, yes, absolutely, you can work on it with your therapist. But I think you can really get into your subconscious and do a lot of healing and changing through modes of therapy, like hypnotherapy, theta healing, neurolinguistic programming, I think it's EMDR. There's a lot of non-traditional sort of modes of therapy that are very, very effective, that I find to be, and I personally practice that, and I believe I thank God have been able to get a lot of results using alternative sort of healing modalities versus traditional talk therapy, which to me is effective, but it's very limiting. Anyways, I mentioned sexual abuse earlier. We're not going to get into that right now. I need to do a whole different talk about sexual abuse and the prevalence of it, so we'll talk about that. But all I want to say is, if you have a loved one, or if you are suffering, from mental illness of any sort, give yourself, first of all, let's just be compassionate and respectful, and let's start the dialogue. We're so quick to go to the doctor, if we have a physical, sort of ailment, right? But for some reason, and we know the reason because of the stigma attached to it, when it comes to mental health issues, we minimize, we make excuses, we don't want to go get help, Again, go to see a psychiatrist. Don't go to your family doctor. Not that they're not capable of giving you a prescription for antidepressants, but a psychiatrist is specifically trained in that. So, if you need something, medication is like, it's like a crapshoot, when you go, because the same medication will work very differently for two people, and you won't know how the medication works until you take it. So it is really important that, you not just, if you're taking medication, it's important that you're going every month. In the beginning, it might be every 2 weeks, to go see how is that medication working for you. The dose might have to be adjusted, even if you've been taking the medication for months, if not years, if it's a man or a woman, it doesn't matter. Our bodies are constantly changing, and hormonal changes happen, estrogen level, whatever. And the medication works and doesn't work. So sometimes you need something, a dosage adjusted. Sometimes you need a little less, a little more. Sometimes you need something addition. Sometimes you need to just be tapered off. I would never just stop taking a medication. One of the things that, I've done, and I've been on antidepressants, thank God not anymore, because again, I've got strong coping skills that I am able to live without it. But mind you, I'm the first one to get back on medication if I feel like I need it. And for the last, 19 years, 17 years or so, I have no problem getting back on medication. But even though I'm a professional in the field, I fought it, right? I have, in the past, I will take, what people do is that we'll take medications, we start to feel better, and then we start to think, oh, I'm doing fine now, I don't need the medication. So we stop taking the medication. Slowly we'll miss a day. Oh, I missed a day, but I'm still feeling okay. So we'll miss a couple more days, and then eventually we'll stop. Well, what happens is, with a lot of these psychotropic medications, it builds in your system, it builds in your bloodstream. So when you stop taking it, your sort of reserves are, tapped into, and so you don't always have a crash. But at some point, whether it's a week or whether it's a couple of weeks, the reserve of medication that's stored in your body, eventually in your blood, eventually just does get depleted and used up, and that's when you crash. So then your level of depression is much lower. So say if your baseline is here, and your regular, I mean, and there is no such thing as normal. Everyone, I'm not even going to tell you a normal is here, because there is no such thing. Everyone's normal is different. But if, say, your baseline normal is here, you have a depressive episode, it might drop down. Medication might bring it up there. But the next time you don't take you stop, it drops a little lower, and it becomes that much harder and that much longer to bring your baseline up. So if you're on medication, don't just stop taking the medication. If you really work with your psychiatrist to, taper it off. If you want to get off your medication, make sure you have other coping mechanisms in place. What are some coping mechanisms? I think having a strong support system is very important. Having a therapist that you can go talk to, but in addition, having friends, having family, having hobbies that, you enjoy, I think just, different things that you can also do is, I think meditation is very, very powerful. Using things to sort of, distract your mind, going for a walk, reading. Anyways, listen, my internet is very sketchy up here, so I'm going to go ahead and stop. If you have any questions, please write about it. Please inbox me or message, comment on here. I think this is a very important and necessary conversation to have. Like I said, hopefully I will be doing something on abuse, physical, emotional, psychological, and of course sexual abuse. I think that is very, very prevalent. I think we need to stop and take the stigma away from this conversation, and let's just talk about it. No one's to be blamed. It is what it is. We're dealing with it anyways. There's a lot of pain around it, so let's just talk about it. And like Brene Brown says, when you take away the stigma and the shame, and you actually, how do you do that? When you talk about something, the shame goes away, So thank you so much for listening. Thank you so much for joining. If this has been helpful, please go ahead and comment, go ahead and share. We really need to, again, come together as a community and make this where this is as common as, unfortunately, heart disease or cancer. We have no issues talking about that, but for some reason, when it comes to mental health, no one wants to talk about it, right? So anyways, God bless, and have a wonderful evening. Take care.